Hello, and welcome to Abby Tyler's Healthy Living. My name is Abby Tyler. I'm your host, a family nurse practitioner, a health and wellness blogger, and a community volunteer. In here, we discuss evidence based health information regarding mind, body, and soul with a holistic emphasis. Thanks for joining me on this journey of health and wellness. Please enjoy the show. Hello, ATHLers. Welcome to our weekly show. My name is Abby. I'm your Health Living NP. How are you guys doing? Hope all is well. Ah, I haven't been on your line for a little bit. So, as you can see, the topic there is antibiotics or antibiotics, do's and don'ts. Alrighty, so please share the show. Please share the show. Please give me a thumbs up, leave comments. I'll read the comments during the show. Also, and I can also read it after too. So, again, as I start my disclaimer, I am a provider, but I'm not your provider. So please do not make any changes to your regimen without checking with your own provider. Let me get my manners. I'll put my glasses on here. Okay, so I'm going here. Please excuse the noise in the background. Alrighty, so let's get into that. So, again, start again, antibiotics do's and don'ts. Now, when people go to the doctor's office or go to the provider's office or urgent care, and you go there with a common cold and you're like, okay, I know I've been sick, I have a cold, and they want you to give antibiotic. And some people are like, I'm not leaving until I get my antibiotic, and you don't need an antibiotic. There are many illnesses that you don't need an antibiotics for, but some doctors were prescribing in the past, and that led to a lot of super infections and all that. So it's important that if you don't need it, they're not going to prescribe it. It's not like they're being mean, but if you don't need it, we're not going to prescribe it. Okay. So let's go in here and see like things like, for common colds and things like that. Viral infection is viral infection. The antibiotic's not going to take care of it. The antibiotic takes care of bacterial infection, not the viral infection like the common cold and stuff like that. You're not going to get an antibiotic for that. Okay. So let's see here. Let's go in here. I said, I'm just putting ABX just over the antibiotics. Okay. So take antibiotics only if you need them. Alrighty. So for strep throat, whooping cough, urinary tract infection. Urinary tract infection affects a lot of people, especially for young girls who are learning how to take care of themselves, older women who as they get older, the anatomical differences and all that. I'm not going to go too much into detail of that. So that can also for men, if you're not drinking enough fluids and all that or whatever is going on, you can get urinary tract infection, and you need antibiotics for that. So, but we're not going to give you antibiotics for like the common cold, your running nose, and as much, even if it's thick, if you're putting out thick yellow sputum or like snot from your nose. I'm just going to use regular terminology. Or green, we're not going to do that. Now, if you start saying that you're coughing, your chest hurts, and you feel like a little bit of pain and all that, we might do it, x-ray, chest x-ray, just to make sure nothing else is going on there. Most sore throat, except for strep throat, we're not going to give you antibiotics for that. For the flu, we're not going to do that. Alrighty. And that also depends on your doctor depending on your presenting symptoms, your medical history and all that, everything else is going on with you and everything that's going on around you to your doctor. Remember, they're going to be taking care of you based on your own individual past history and all that. So they may say, let's do other testing before we before we prescribe antibiotics. Does that mean that some doctors may not prescribe it? Even though you don't need it, some of them might say, okay, yes, because we're trying to treat you, make sure you don't get more infected. Some may do that, but most times the general rule is we do not prescribe for things that are not bacterial infection, okay? Because antibiotic, and people might say, oh yes, well, I took the antibiotics and it made me feel good after that. You are going to feel good eventually. If it's a viral infection, you are going to feel good anyway. So it just happens that you took the antibiotic, and during that time, usually from 7 to 10 days, you're feeling better. Alrighty. So it's important that we do that. So, we'll give you antibiotic for like a sinus infection, things like that. Alrighty. So taking, again, like I said, if you take an antibiotic for a viral infection, you're going to feel good eventually, but the antibiotic didn't do any good. Alrighty. So the next one is take antibiotics exactly as a prescribed. Alrighty. So if we tell you to take the antibiotic and 3 times a day, we're going to tell you, okay, yes, we want you to take it every 8 hours. Already. So make sure it's taking that 8 hour span. Look at the clock and say, okay, I'm taking 6 o'clock in the morning, I'm taking it 2 o'clock, and I'm taking it 10 o'clock. If it work, you can work it around your work schedule, your school schedule too. And sometimes it's like if your kids have to take the antibiotics when they go to school, in America, I can't talk for other places, they fill up the forms at the beginning of the school year that they cannot take any medication with them. You have to give it to the nurse when they take it to. So you don't want to have them with it in their bags and all that, because other kids can get into it, and that can cause some serious problems too. So make sure if it falls around the time that the kids are going to be in school, to send it to the school in everything labeled. They tell you everything has to be labeled and taken to the school nurse if they have to take it at school. All right. So take it as the way you prescribe. Take it exactly. Completed. Even if you're feeling better, make sure it's completed before you don't just put it down because I'm feeling better, so I'm going to put it there. No, take it the way it's prescribed. All righty. Do not share antibiotics with anybody else, because again, if they're taking any other medication, it may interact with that. So it's important that you do not share your antibodies. I know sometimes antibody can be expensive too, especially depending on where part of the world. Even over here too, you don't have insurance, and some people have like their own fixed income too, so they can afford like really expensive drugs and all that. Even if the insurance pays, the copay could be a little expensive, a little pricey for them. But it's important that you do not share the antibiotics with them, because again, like I said, they may have other issues that they may have an allergic reaction to, or other medications that may affect that. So please do not share antibiotics with anybody else. Do not save them for later. Some patients will say, oh yeah, I was feeling better, I kept it, and then like 2 weeks later or like a month later, I wasn't feeling good. So I said, you know what, I still have a little bit left, I'm just going to take that. Do not do that, because as the medication stays in your medicine cabinet and all that, or wherever it is you keep your medication, make sure you ask into where's the best place to keep your medication. Alrighty. The components in there start degrading, and that could be a little toxic to you. All right. And also the efficacy of the medication, it may not be as strong anymore. So because it wasn't in your system the entire time it was supposed to be in there. So it's important that you do not keep the medication. Don't save it for later. Take it. You're feeling better, take it completely. If it says 10 days, you take it 10 days. If you're feeling better, okay, because you want to take that so you don't get the infection back and get it back even sicker than you were before. Alrighty. Do not take any prescription medication. Do not take any antibiotics or any prescription medications that are meant for anybody else too. Okay. Because again, when you're taking the medication, you say, okay, she left some over. I'm just going to take this same medication that she was taking. She left maybe like a couple of pills over. I can take that but then that means you're not taking the full length of your infection. So again, the allergic reaction, the side effects, and all that. So it's important that you do not do that. Don't take the medication. Just go to your doctor and get this. And then sometimes people say, well, I don't have the time to go to my doctor's. They don't have an appointment there. Depending on where you are, you can always go to urgent care. And some insurance company will, you can go to urgent care if you couldn't make it to your doctor. Of course, you want to say you call your doctor's office first, and they didn't have time for you to come in right away. So that's the reason why you went to urgent care. Okay. Most places now, even some hospitals too, they have like little clinics within the hospitals too now. So find out from your local hospital how they work that way. Some after hours, and the doctor office I go to, they open like I think about 24/7, 7 days a week, and I think they open late too. So it's always good to get a doctor's office that you can they're available. And sometimes some places have telehealth too, so you can get online with them and they can go there. But the thing about it, they don't be listening to your lungs and other things. But it's important, at least that way they can see your face and talk to you. Okay. Alrighty. And telehealth, you still have to pay, by the way. So they'll tell you put your money in, and then the doctor will come on. Alrighty. So tell your doctor about any side effects. It's very important. Every medication comes with side effects. We weigh the risk and benefits. Okay. Because some people say, why are you going to give me that if something's going to happen to me? Yes, you need to get this infection out of your body. And if you have a little bit of rash, we can take care of it. If you have a little bit of discomfort, we can take care of it. But you need this medication. All right. So some of the medications, some of the side effects that we'll talk about already. Let me go in here. So if you have a little bit of rash, like I said, we can always give you medication to help with the rash. A little bit of nausea. You feel like when you want to vomit, we can also give you medication that we can tell you take the medication. Maybe you take the medication with food so it doesn't upset your stomach. Some medication has to be taken with that separate away from other medications too. So we might tell you don't take this during this time. And about a little bit of nausea, if it lingers for a couple of days, then also tell your doctor that, because we don't want you sitting there and vomiting and you're not keeping the medication in. All right. A little bit of diarrhea here and there, making sure you're drinking a lot of water. If you don't have any other medical issues with drinking too much water, things of water. Again, and you having diarrhea, you want to be eating like dry toast, maybe dry rice or so, and all that applesauce and stuff. So you can kind of help with the diarrhea. So a little bit here and there, that's okay already. Some antibiotics also cause yeast infection too. So for women, yeast infection basically is like when you have a lot of discharge and all that from your vaginal area, and that can be a little itching too. So sometimes we may give you antibiotic for something else, and we give you medication to kind of combat any yeast infection that may occur. All right. Also, something can be burning. If you have UTI, urinary tract infection too, we might give you the medication also to help with the burning sensation. So the antibiotic will be taking care of the bacteria. We'll give you the medication that's going to cause you, help with the burning sensation and all that. And then also the other medication that we give you to help with the yeast infection. Because again, when you take certain medications on women, you have the healthy bacteria in there, healthy bacteria in your gut, healthy bacteria in your bladder, healthy bacteria in the vaginal area. But when you're taking this medication and all that too, it kind of upsets that. So you may need medication to kind of combat that. Okay. And some itching too, a little bit of itching here and there. Remember back home when we used to take chloroquine and you would be itching, so that mean the allergic reaction. It was like gnawing at your skin. I used to be scratching my skin so it would almost peel off. And I used to be in the bed and almost like screaming my head off. And it's like, oh yeah, that means it's working. And that's how they told us, yeah, it's working. And I didn't even know it was really chloroquine anyways, because we used to buy things right on the street. That was very dangerous, by the way. So and then I came here and I started going to school, and I was like, no, it's an allergic reaction. You're not supposed to be in that discomfort. That's that much discomfort when you're taking medication and they say it's working. No, when you're severely scratching your skin like that and you're so irritable in the bed and all that too, that is not means doesn't mean it's working. Okay, that means like you have an allergic reaction. Alrighty. So the most important and more serious ones, C. diff. Okay, when you're having this diarrhea that is so like it's just pouring right out of you. You can't do anything. You leave the bathroom, you have to go back, and it has like a strange odor to it. It's very, 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 very important that you let your doctor know, because that's causing infection in your stool. Like I said, is messing up with the healthy bacteria. Sometimes we'll give you a pill to kind of help with so it doesn't upset your bacteria in your stomach. All right. It might tell you to eat some yogurt or something else with it. Alrighty. So make sure you tell them, because then you may have to go into additional antibiotic. But if you're having like massive diarrhea and this smell is really potent. All right. And it's different from anything you've ever smelled before. You may have to go to the hospital for IV antibiotics, especially if you're just laying there and weakened and all that too, and not being able to reduce to something. You definitely need to go to the hospital. Alrighty. And then also you taking the medication, like I said, take it like you're supposed to, because if you don't take it, then you develop a super infection, and that can cause a lot of problems. Or you build up a resistance to a certain antibiotic, and it limits how much the kind of antibiotics that we can prescribe for you. Alrighty. So, and the most important thing, if you find yourself scratching, your throat start itching, and you feel like, oh my God, I feel like I'm having difficulty swallowing, or difficulty, like it feels like I can't breathe and all, 911 right out, because that means you're having the most severe reaction that we can think about. So please, 911, get out, because it's like almost like an anaphylactic attack. So you want to go, because your throat starts swelling up, and eventually and that can basically lead to death. So you need to go out and go right away and go get your stuff checked. Okay. So yeah, see here. Alrighty, so going back to it again. So somebody might say, well, why are you giving me that and all that? Because like I said, if it's something minor, we can take care of it. But we also look at the fact that, okay, say you have an infection, that if you don't take this antibiotic, it may whatever it is that you're doing, let's say it's like open wound or something else, like you came down with something else really serious, and it might get worse. So we'll say we'll take care of the little minor side effects already, and then we can take the medication. Sometimes we may have to change the medication because you had an allergic reaction and all that too, but it's important that you do take the medication and you do report your side effects to your doctor and all that. Call and say, this is what's going on. I just want to make sure nothing else more serious that I need to know. But the most important thing, you feel your throat itching and all that, especially also some severe rashes called Steven-Johnson syndrome. You look that up. That's just go to 911. Okay, just get to the hospital as soon as possible. Alrighty. So why shouldn't you take antibiotics? Somebody say, why shouldn't I take antibiotics that's not prescribed for me? I already went through most of that. You may not need it. again, like I said, why would you take an antibiotic? Somebody says, oh, yes, I'm antibiotic here. Okay. Or why aren't you giving me antibiotics? Because you don't need it. You have a cold. You don't need it. We can give you a medication that can help with the cold. We can tell you to buy stuff over the counter. You don't need a medication, all right? You may need a different antibiotics. Let's say if you had a urinary tract infection, all right, or like something that in your wound or stuff that was in the culture, and you're taking an antibiotic that is not treating that particular bacteria. Let's say we'll tell you to wait for the culture to come back, all righty? And you're taking an antibiotic and we get the culture back to tell you what bacteria it is and what it's resistance to and what antibiotics that is for that particular bacteria, and it's not the antibiotic that you're supposed to be taking. So now you're taking something that could possibly harm you because of the side effects and all that, and it's or something that just not going to work. All right, because even sometimes in the hospital, we may give you an antibiotic to treat you until we get the culture back, or in the doctor's office, and we'll call you and say, stop taking that antibiotic because it's not working. It's not going to kill the bacteria that say, or it's resistant to that particular bacteria. So you may not need it, and why put yourself in danger of that? Okay, like I said, endangering your own health because you could be taking an antibiotic that is like interacting with your other medications too. So it's important because again, like I said, there's some antibiotics that you're not supposed to be taking and you say, okay, well, I'm just taking that. My friend took it and she was sick and she took the same medication and all that and she was fine. What? You and your friend don't have the same chemical maker, and also the fact that you may be taking medication that your friend doesn't take. Even if you guys take the same medication, it's still not the same. You may react differently to it. So that's important, okay? And sometimes they said there isn't enough left, so I just took my friend's medication. Again, we go back to because you took a little bit, so you weren't treated for the entire period. Maybe you need something for 7 days, maybe you need something for 2 weeks, maybe you need something for longer than that. So it's important that you do not do that. Alrighty. And I know again, like I said, things are expensive and sometimes people can afford that. And you say, I'm just going to take that. And plus, I was taking that, I was taking any kind of medication back home in Liberia and it worked. Again, like by the grace of God, some of us are here. So, but there were other people who something happened to and were like, oh, maybe that was witchcraft or God's will. So who knows? So it's important. Not saying that, I'm not talking against anybody, but it's important that when you know better, you do better. And you were buying medication off the street there. So the person who was giving you the medication didn't have that kind of responsibility that I would have. So I wouldn't give you a medication that you don't need. And I would tell you these things and all that. But if you also, I failed to mention that if you do have an allergic reaction, let's say you develop a like severe rash or you develop like coughing or something else that happened when you were on antibiotics, make sure when you go to any health facility, if you even go back to your primary care doctor or any other doctor that you have to go to, like any specialist, or you happen to go to urgent care or other places, it's important that you tell them, yes, I cannot take this medication. Please remember the medication you were taking. Okay, it's important. When were you taking this medication? Sometimes we can just look in the computer and look at and go into different database and get that medication you were taking. But it's important that you let us know so that way we're not giving you medication that you already developed an allergy to, allergic reaction to. Okay, so it's important. So I cannot take this medication. And when you take the medication, when you tell them I cannot take, let's say I cannot take Levaquin. What happens when you take Levaquin? Oh, I get a little bit of rash. Okay, maybe when I give you that. Oh, the last time I took Levaquin or I took penicillin, my whole body just blew up in blisters or this, or I could, you'll be like, oh, okay, that's a really, really major reaction. So we definitely cannot give you anything like that or anything that has the same kind of components. Alrighty. So it's important. Alrighty. So let me just see here. I'm going to look at the comment section. Okay. Somebody said I have to talk slower. So I'm sorry. Good topic, but you're talking too fast. I always try to talk slow. Don't waste your day there to be here and no understanding. Well, thank you. Thank you. Thanks for coming in, anyways. Alrighty. And this person said, I'm following from South Korea. Thank you very much. Alrighty. So let's go back to my banner there. So, okay. So I talked about why you shouldn't take any medication that you should be taking already. So we talked about that. So also you can ask the ways to let me go in here. I think I did that one. So you can find the ways to feel better if your antibiotic is not needed. So sometimes you'd be like, okay, so I went in and they told me that I don't need antibiotics. So now what? I have this, I'm still having symptoms, and we're not denying your symptoms. You still have the symptoms and all. So we might say, okay, let's say you're having a bad cough. Go ahead and go to the store and get something over the counter. Again, even if you're taking something over the counter, ask your doctor and all that, or ask your pharmacist and say, okay, I'm taking this other medication. You can ask the pharmacist. Try to get to the pharmacy when they're not too busy, because sometimes they're overworked too, so they may not have the time to talk to you if you're not getting medication, because remember, it's separate. The if you're getting something over the counter, is separate from what a pharmacy is. Okay, depending on the kind of pharmacy that you go to. So it's important that you go ahead and say, I'm taking this medication, because some cough medicine can also raise your blood pressure. Already, some cough medicine can make you, depending on the components and on there, it can make you a little dizzy, and sometimes some people get high from certain cough medicine. So some cough medicines are like behind the counter now. You can't even get to it. It has to be prescribed, or they have to go through all of this to give you the medicine. So eat healthy, get enough rest, drink enough water, get enough rest, eating healthy again, exercise and staying active. All of that can help you get better, because you want to build up the resistance. You want to build up the strength and everything. So when you do get sick, you have that power to break it. You have to fight yourself, because it's something that's invading your body, and you need to have the strength in order to fight it back. Okay, so it's so important that you stay. Even if you were taking antibiotics, it's still important that you exercise and stay healthy, active, get enough rest, but stay active as much as possible. Alrighty. And preventive care, almost similar to what I just said. So preventive care, do your best to stay healthy. I did do a video on proper hand washing, the one we do in healthcare. I'm gonna probably do another one eventually. I did that when we had Ebola. So wash your hands as much as possible. If you have hand sanitizer, use the hand sanitizer as much as possible. But wash your hands eventually, because even when you do use the hand sanitizer and all that, after a couple, or maybe like an hour or so, you can see, when you wash your hands, you can see how dirty it is, because it does stay on your hand for a while. Already, cover your mouth and nose when you're coughing and sneezing, making sure you're coughing over here and not here, because if you do cough in your hands, then chances are, more than likely, you're not going to be washing your hands or doing anything. You're going to be touching somebody's clothes. You're going to be touching the faucet. You're going to be touching the doorknob, and also it's important that you do this: cough in here. Already, have some tissue around and all that. See, some people say like handkerchief, but handkerchief is like so old. So use tissue. But if you have handkerchief, go ahead and use it, and make sure you're washing it at night too. All right. Staying home when you're sick, that is not always possible, because people have to go to work, they have to take care of their families and all. So, but when you're really, really sick, try to stay home as much as possible, okay? And when you're staying home, especially when you're like in the height of the illness, try to stay home as much as possible. That's like if you have an infection where, coughing and things like that, that can get to somebody else. Avoid touching your eyes, nose, and mouth and all, because these are all your mucous membranes over here. They have the pores that if you're touching that, it can go right into your system. So keep your hands away from your mouth, because I see people doing this, like they're touching their mouth, or they're touching the nose and things like that, or like doing their eyes like that. If you have to scratch your eyes, you can always just go like that. Your nose, do that, and all. If you have to do that, wash your hands after you do it, okay? And avoid close contact with people who have cold or upper respiratory infection. So if somebody has a cold and things like that, stay away from them, especially during this time of the year too. People having pink eyes, that's highly contagious. Stay away from them. Stay away from them. If they're in your house, there's not much more you can do, but you can wipe down the surfaces, especially wipe down the surfaces as much as possible with an antibacterial spray. Already, spray the toilet, the lever, and all. Spray your cars. People forget that the car, you're steering and all, you're touching everything else. When you come from the store, you come from the grocery shopping, you're touching the dirty carts. Wipe all that. I have a hand sanitizer in my purse. I have a hand sanitizer in my car and all that too. So I'm covered, and I have it like at my front door. So when people come in, or when I come in too, I always just go in there and just clean my hands. All right. And if you have to get the flu vaccine, especially for people who are elderly, people who work in healthcare, people who have other pre-existing conditions like diabetes, heart disease, it's recommended that everybody just get the flu vaccine, unless if you have any kind of reaction to it and all that. And you have other reasons why you shouldn't get the flu vaccine, get it. If you're supposed to get the pneumonia vaccine, go ahead and get that too. That's also recommended for people older, or like 65 and above, but also for if you have other pre-existing conditions, you need to get that. You want to stay healthy, try to exercise, try to eat healthy, because again, like I said, you want to build up the resistance, build up that strength and all, because when that organism that doesn't belong in your body attacks you, you're strong enough to take care of it. Now, sometimes it can knock you down for the count. The first time I got COVID, I was fine a little bit. I had like a little sore throat and my voice went. But the second time around, I was like knocked out. I was knocked out for the count. I was telling people, I said I felt like, when you just took like a little cat and there's like, felt like a cat dragged a cat in, like and hit my head on every step until I got to the top. That's how sick I was. So, and then of course, if you have like other pre-existing conditions, it's very important that you stay healthy. Alrighty. So I don't want to make this long. I've already been talking for over 20 minutes. So let me just see here for a second. So let me see. Terry said, can you please explain about blood pressure and what foods do we eat all the time? I did do a show on blood pressure, on hypertension and blood pressure and all that too. If you missed that, it's on this forum if you're watching from Focus on Liberia. So just go there and look down. Alrighty. And it's on there. But it's important when you eating blood pressure, if for high blood pressure, you want to be eating food that don't have too much oil in it, salt. Don't eat heavy foods at night. Don't eat too much red meat. Try to eat a lot of fish, a lot of like boni and things like that, and cut back on the rice intake. Or if you're gonna eat rice, eat some brown rice here and there. You can mix it up if you're not used to brown rice, and try to stay healthy. Of course, same thing with the infection and all that too. Exercise at least 30 minutes a day, at least 3 to 5 days a week or more if you can do that, and do your best to stay healthy. And also follow with your doctor too, especially if you get your baseline blood pressure. And then if he's giving you medication, take the medication like you're supposed to, but also follow up like they tell you, because they have to make sure that if you're taking certain medications, certain blood pressure medications too, they do affect other things in your body. So you may have some blood work and they can follow up from there. Okay, but I did do a show on that. All right. And thanks for that. So I don't see any other questions there. Let me go back here to my banner. So it's important, antibiotics, people might think that, okay, yeah, it's just something where, oh, I'll just do it. And it does a lot of good. For the longest time, people died unnecessarily because there weren't antibiotics. But at the same time, you want to make sure that you take it to where you're not going to cause yourself any danger if you don't necessarily have to do it. And then it also is important that if it's prescribed for you, that you take it the way it's prescribed for you. Take your medication completed. Do not share medication. Do not share medication. Ask your doctor, how am I supposed to take this every 8 hours? What happens if I miss it? Do I take it again, or do I just wait for the next dose? Know how to keep yourself healthy and keep your family healthy. And especially if you have children, please make sure you're talking to the pediatrician and getting guidance from your pediatrician. If you're pregnant, that is even more reason to talk to your OBGYN, okay? Because there are many medications that pregnant people cannot take. All right. So if you get sick and say, oh yeah, go ahead and take this, there's so many medications that pregnant people cannot take, and we have to watch for everything because it may affect you, it may not affect you, but it may affect the baby or it may affect both of you. So it's important, okay? So thank you all for watching. For those of you who will be watching later, I say thank you. For those of you who watch now, I say thank you. I'm still taking comments, questions, and all that too. I go back and I read it. For those of you who have not joined Abby Tyler's Healthy Living page, it's the sign right behind me over there. All right, it says page at the end of it. So when you look at it on Facebook, it has this color. All right, please join, because I do put daily videos out. I haven't been doing that much recently, but I try to do little short videos here and there during the week. Okay, and I have much more on there. So I'm all focused on Liberia only once a week, but I do a lot of things on the forum itself. So thank you all for watching. Alrighty, and for those of you who thought I was anyway, but you can slow it down and listen and also. But I'll talk to you guys later. Thank you all for all your love and support. I wish you all a good night, a beautiful rest of the week, and I will talk to you guys later. Stay healthy and stay safe. Bye bye. Good night.